Hey there, future pharmacologists. Welcome back to the Pharmacology Vault, where we break down tough drug concepts into simple, high-yield content. In today's video, we're talking about a powerful class of medications used in hypertension, BPH, and even rare conditions like pheochromocytoma. These are the α-Adrenergic blocking drugs, or simply, alpha blockers. First things first, what exactly are alpha blockers? These drugs block α-Adrenergic receptors, the same receptors activated by norepinephrine and epinephrine in the sympathetic nervous system. By blocking these receptors, they cause vasodilation, that means lowered blood pressure. Relaxation of smooth muscle, especially in the urinary tract. Pretty useful, right? Now, where do they actually work? There are two main types of alpha receptors, alpha-1 receptors. Located in vascular smooth muscle and the lower urinary tract. Blocking them causes blood vessels to dilate and urine flow to improve alpha-2 receptors. Found presynaptically, they regulate the release of norepinephrine, not commonly targeted by most alpha blockers used clinically. So, most drugs we talk about today focus on alpha-1. There are two main types of alpha blockers you should know. These drugs selectively block the alpha-1 receptors, which are mostly found on blood vessels and in the urinary tract. What does this mean? They cause vasodilation, which lowers blood pressure. They relax smooth muscles in the urinary tract, helping relieve symptoms of urinary obstruction, very useful in conditions like benign prostatic hyperplasia, BPH. Some common drugs in this group include Prazosin, often used for hypertension. Tamsulosin, primarily for BPH. These selective blockers are popular because they provide targeted effects with fewer side effects. On the other hand, we have non-selective alpha blockers. These drugs block both alpha-1 and alpha-2 receptors. Why is this important? Because alpha-2 receptors play a role in regulating norepinephrine release. Blocking them causes broader systemic effects, which means they can have more complex actions and side effects. Two main examples are Phentolamine, often used in emergency situations like hypertensive crisis. Phenoxybenzamine, an irreversible blocker, mainly used preoperatively in pheochromocytoma. So, non-selective blockers act more broadly but are reserved for special cases. Alpha blockers can be broadly classified into two major types: non-equilibrium, irreversible, equilibrium, competitive or reversible. Let's break these down. Non-equilibrium type, irreversible alpha blockers. These drugs form a covalent bond with the receptor, meaning the block is long-lasting and irreversible. The main drug in this class is Phenoxybenzamine. It's a beta-haloalkylamine, and it irreversibly blocks both alpha and alpha receptors. Used mainly in pheochromocytoma, where long-lasting alpha blockade is needed before surgery. Remember, irreversible equals sustained effect. Equilibrium type, reversible, competitive antagonists. Now on to the more common group, the competitive alpha blockers, which bind reversibly to the receptors. These are further divided based on receptor selectivity. Non-selective alpha blockers, alpha-1 plus alpha-2. These drugs block both alpha-1 and alpha-2 receptors, and they come from different chemical groups. Ergot alkaloids. Ergotamine and ergotoxin, known for their vasoconstrictive effects in migraines, but they also block alpha receptors. Hydrogenated ergot derivatives, dihydroergotamine, DHE, dihydroergotoxin, codergicrin, used for migraines and some circulatory issues. Imidazoline derivative, Phentolamine, a short-acting, reversible alpha blocker used in hypertensive emergencies and pheochromocytoma. Miscellaneous, chlorpromazine, though primarily an antipsychotic, it also has weak alpha blocking activity. Selective alpha blockers. These drugs selectively block alpha receptors, leading to vasodilation and relaxation of urinary tract smooth muscle. Very useful in hypertension and BPH. Key examples include Prazosin, Terazosin, Doxazosin, Alfuzosin, Tamsulosin, Selectivity. Quick tip: Osin ending is a giveaway for alpha-1 selective blockers. Selective alpha-2 blocker. Finally, we have a rare one, the selective alpha-2 blocker, Yohimbine, historically used for erectile dysfunction and sometimes in veterinary medicine. Today, it's mostly of academic interest, as newer drugs have taken its place. Alpha blockers are used in various conditions ranging from hypertension and BPH to rare endocrine tumors and even migraines. Let's go through them one by one. Pheochromocytoma, pre-op blood pressure control. Pheochromocytoma is a tumor of the adrenal medulla that secretes massive amounts of catecholamines, leading to dangerously high blood pressure. Before surgery, we need to block those alpha receptors to prevent a hypertensive crisis. Drugs of choice: Phenoxybenzamine, irreversible alpha blocker. Phentolamine, short-acting, reversible. Remember, always block alpha before beta in pheochromocytoma prep. Hypertension, especially with benign prostatic hyperplasia. Some alpha blockers can lower blood pressure and relieve urinary symptoms due to prostate enlargement, a double benefit in older men. Commonly used drugs: Prazosin, Terazosin, Doxazosin. These cause vasodilation without significant reflex tachycardia. Benign prostatic hyperplasia, BPH, smooth muscle relaxation in the prostate and bladder neck improves urinary flow. Best suited drugs: Tamsulosin, Alfuzosin, Selectivity. These are uro-selective alpha blockers, meaning fewer cardiovascular side effects. Peripheral vascular diseases: Raynaud's phenomenon, acrocyanosis. In these conditions, there's excessive vasoconstriction in response to cold or stress. Effective options: dihydroergotamine, an ergot derivative. Prazosin, improves blood flow to extremities. Erectile dysfunction, rare use. Before PDE5 inhibitors became the gold standard, we had yohimbine, a selective alpha blocker. It increased blood flow by reducing sympathetic tone, but it's now rarely used due to inconsistent results and side effects. Migraine, abortive therapy. Migraines are thought to involve vasodilation of intracranial vessels. So, vasoconstriction helps relieve the pain. Used drugs: ergotamine, dihydroergotamine, DHE. They act on alpha receptors and serotonin receptors, making them useful abortive agents. Chronic heart failure, adjunct therapy. Alpha blockers aren't first line in CHF, but in some cases, Prazosin has been used as an adjunct due to its vasodilatory effects. However, it's now rarely preferred, as better agents like ACE inhibitors and ARBs are available. Tyramine-induced hypertensive crisis, MAOI interaction. MAO inhibitors prevent breakdown of tyramine, which can lead to massive catecholamine release if certain foods are consumed. Emergency drug: Phentolamine, short-acting alpha blocker used to quickly lower BP during hypertensive crises. And there you have it. From adrenal tumors to migraines, alpha blockers have a surprisingly diverse clinical role, although some are now historical or used in very specific cases. If this video helped you connect the pharmacology with real-world use, drop a like, share it with your classmates, and subscribe to the Pharmacology Vault for more concise content. Catch you in the next video.